Hey teams, in this week's video, I want to talk to you about the new patient phone call. Now, if you know me, if you've worked with me, or if I've done training for you, you know I'm not a huge fan of scripts, but I am a huge fan of formulas and following a specific formula to have more productive conversations with your patients, but also to roll out the red carpet for them. So the perfect greeting, let's start there. So the phone rings and you might say, hey, good morning, good afternoon, this is Lauren. We're going to scratch that a little bit, okay? So we're going to enhance that conversation. So I want you to follow the 3-part formula, which is gratification, education, ease of business. Now, instead of the good morning or good afternoon, we start with gratification. First, you should thank your patients for coming to call you. Whether it's a new patient, a recall patient, a vendor, the wrong number, anybody that took the time to give you a call, you should absolutely thank them for calling you. So thank you for calling. It's short, it's sweet, and it's easy. And I will say, I always get questions on the front end of, Lauren, I like to say good morning or good afternoon. Why wouldn't I use that in my language to answer the phone? Well, for ease of business, that's why we don't do it. It's much easier just to say, hey, thank you for calling versus a good morning or good afternoon. And the reason I'm not a fan of good morning and good afternoon is because have you ever been answering the phone? Maybe it's right around lunchtime and you say good morning and then you look at the clock and you're like, wait, no, I mean good afternoon. It's just this awkward exchange because it's already noontime and it's no longer the morning. So for pure and sheer ease of business, that's why I drop off good morning and good afternoon and jump right into thank you for calling. Now, remember I said it's a 3-part formula: gratification, education, ease of business. So you might say, thank you for calling BIZROK Family Dental. So I gave the practice name. This is Lauren. I gave my name. So I'm educating the patient that 1, you've called the right place. And 2, my name is Lauren. And then 3, ease of business. How may I help you? Ease of business tells the patient that I'm finished speaking, now you can speak, but it also is, how may I help you? That's a great transition conversation or question to your patient to put the ball back in their court and find out what they're trying to accomplish from that phone call. So let the patient speak. They might say, hey, I wanted to see if you're accepting new patients. Are you in network with Blue Cross Blue Shield? I'm in a lot of pain, whatever their question is. So you said, thank you for calling BIZROK Family Dental. This is Lauren. How may I help you? And then the patient asks their question. Once they ask their question, you're going to acknowledge it in a couple different ways. So let's say the patient says, are you accepting new patients? You want to acknowledge that and then learn who you're speaking to. We absolutely are accepting new patients. May I ask for your full name? Get to know that patient. Get their name on the front end. By asking for their full name, John Smith or whatever their name is, you can start using their name throughout the conversation. So as soon as they say, oh, John Smith, John, well, let me be the first to welcome you. If they asked if you're accepting new patients, they already told you they're a new patient. They're calling, they're new, they haven't been to see you. So you want to start building that rapport with them. And again, let me be the first to welcome you. Roll out the red carpet for those patients, guys. You want to start them off on a positive and make them feel so welcome that they happen to call your practice and you're so honored that they took that time to give you a call. So we went through the greeting, we went through the patient asks any question under the sun, acknowledge it. If you're accepting new patients, that's the easy one. If they say, are you in network with Blue Cross Blue Shield? You might say, if you are, you'll say, we are in network with Blue Cross Blue Shield and I'm happy to help you. But first, may I ask who I'm speaking to? Get that patient's name again on that front end of the conversation so you can begin to have that rapport building and use their name throughout the conversation. You also want to get their phone number. Guys, we are all busy. Sometimes we go phone call to phone call to phone call in the dental office. Your patients do that too. They're running from thing to thing, whether it's at work or they're running kids around or they're running personal errands. Everyone has something going on. And so you want to get their full name, but you also want to get their phone number on the front end. So let's break it down together, okay? So are you accepting new patients is what the patient asks. You want to acknowledge that. We absolutely are, and I'm more than happy to help you with that. Let me be the first to welcome you. May I get your full name and a phone number for you. John Smith, my phone number is 1234, etc. Then you can transition with another question. The next question that you might ask your patient is, John, are you calling for something specific, or are you calling to schedule for a routine cleaning? The great news about this question, this transition question, is it tells you exactly where you need to guide your patient, whether it's for a hygiene visit or if they need to come in to see the doctor for something specific. Now, I want to make sure that you use that verbiage of something specific, not an emergency, an issue, something wrong. We want to have positive conversations with our patients. And as soon as we say emergency or issue, it puts a negative connotation in their mind. So we're trying to build rapport with that patient, but we're also trying to create a positive and unique experience with the patient. And how we do that is always falling back on positive words. So are you calling for something specific or for a routine cleaning? That tells you, whoever's answering the phone, exactly the type of appointment that you need to schedule. Now, it's outside of the scope of this conversation, and I know multiple practices do things differently. Some schedule always put all new patients on the doctor's side. Some are open to putting it on the hygiene. It doesn't matter. We can talk about those on a one-on-one basis, but let's just assume that the patient says they're scheduling for a cleaning, they're due, they go every 6 months, they don't have any issues. This is just a routine hygiene visit. So we're putting them on the hygiene side, okay? And let's say Heather is our hygienist. So patient said, you say, hey, are you calling for something specific? Or are you calling to schedule for a routine cleaning? And the patient says, I just need to come in for a routine cleaning. I just moved here to the area. I go to the dentist every 6 months, and I'm about due for my next appointment. Well, wonderful. Thank you again for giving our office a call. I'd be more than happy to get you scheduled, and then start to build rapport and authority for your practice. So you might say, I will tell you our hygienists are absolutely amazing. They were hand selected by Dr. Johnson in our practice. Dr. Johnson personally selected every single hygienist and trains with our team every single quarter. How do you think that would make that patient feel? They would probably be like, wow, which practice did I just call? Like, this is unique. This is a different practice than what I'm used to. So you want to continue to roll out that red carpet for your patient. And small ways of building authority for your doctor is a great way to do that. We're not going to jump into insurance. That's a separate conversation. So we will handle that in a separate video. But for this conversation, you've built authority for the doctor and the hygiene team. You'll want to start scheduling your patient's appointment, and you want to use one of my favorite tools, which is the dual alternative close. Now with the dual close, that means you always offer two. One of the best questions that you can ask your patient is, are you wanting to schedule for a morning or an afternoon? That gives you a better guide where you're trying to put your patient, whether it's a morning appointment or an afternoon appointment, and then continue to follow the dual alternative close. So if your patient says, actually, I prefer mornings, always offer them two. You can say, great, our first morning is this day at this time or this day at this time. Always give them two. Now, if you're watching this and we've never done training for you before, you're probably wondering, gosh, why do I always give them two? What's the purpose? I love to give patients lots of options, or I just like to give them the first one I see available. Why do I give them two, Lauren? Well, you want to do that because, people like choices. People like options. People also like feeling like they have a choice in the matter. Whenever you give somebody just one single option, they don't feel like they have a choice. And again, it creates some sort of negative connotation. So you want to make sure that you're making them feel like they have choices. And the reason you don't give multiple options, more than two, is because sometimes what kicks in is paralysis by analysis. They're like, wait, what was that first appointment time? Or if you say, what works best for you? And the patient says Saturdays, and you're not open on Saturdays, then you're having to tell the patient no. So you want to make sure that you're having that positive conversation, but also letting them have some choices. So you go through, you schedule the appointment, again, build authority, you're all set. I'm not sure which hygienist you're gonna be visiting with that day, but let me tell you, all of our hygienists are amazing. So I know no matter who you see, you're gonna be really thrilled that you came into our practice. Then last but not least, tell them your name one more time. You might say, Susie patient, again, my name is Lauren. If you need anything, please give our office a call, but we are looking forward to seeing you soon. So you're just building rapport, and everything builds upon the next, but it's a very easy, seamless conversation to make your patient feel exceptional.